The key to managing bipolar disorder is actually all about learning about yourself. No one can actually tell you exactly what to do to manage your bipolar disorder. It's really very individual. Figuring out a plan can be super helpful when it comes to bipolar disorder, and the more complete and sort of robust your plan is, the better off you're going to be. The key components of a plan are: what do you do that keeps you well? How do you tell when things are going off the rails? And what do you do in that case? So the first part of a successful plan is learning about what things look like when you're well. So how do you know when you're well? What do you feel like? How do you tune into that? And then what are the habits that you have in place? Again, something that most days can help you with, that can keep you stable. Whether it's the kind of social activities that you make a regular part of your life, or a support group, or reading regularly at night, or taking time to chill out every day, whatever it is that keeps things stable for you, that's what's going to work. The next important part of self-knowledge that helps to manage bipolar disorder is how to monitor how you're doing. Keeping track of how you're sleeping, keeping track of how your mood is going, keeping track of did you take your meds or did you not, keeping track of did you drink or use other substances. Most Days has a really good mood tracking component that can help you keep track of all of this. And what's really helpful is also to be able to share that with your provider. If you're seeing a psychiatrist or you're seeing a therapist, that's something that you can share with them on a regular basis. The third major part of having a plan for managing bipolar disorder has to do with how you intervene if you notice that your mood is going down or your mood is going up. At a certain point, you need to contact your provider, whether it's a therapist or a psychiatrist or both, and that's something you want to discuss with your therapist and psychiatrist ahead of time. Your plan should kind of tell you how to intervene depending on the severity of the episode, including when you notice that an episode might be emerging. You might have a medication intervention that you've already discussed with your psychiatrist if you think something is emerging, and then there might be behavioral interventions as well. The important thing to remember about learning to manage bipolar disorder is that it's totally doable, and it's something that's up to you. Just putting in the hard work and trial and error and noticing what works for you is itself what works. And if you put your attention and your effort into that, it does get better over time.